Angina. What is angina? Recognition of angina and first aid steps to take should someone have an angina attack. Angina is a problem with the heart, and it's when there is a restriction of blood to the heart. And that restriction, when the artery narrows, slows down the flow of blood. An angina attack can show quite similar to a heart attack. They may have pain in the chest. That pain can go to their throat, to their jaw. It can go down their arms and to the stomach as well, what we call radiating pain. But most of the time, if somebody has angina and their medication, it can be treated extremely quickly. So Edna here has angina. So Edna, you're holding your chest, my lovely. Why are you holding your chest? Have you got some pain?
Some pain, yes.
Have you?
Yeah.
So when Edna's telling me that she's got pain in her chest. So has this happened before, Edna?
It comes and goes.
Oh, does it? Okay. Do you have angina?
I do.
You do have angina. Okay, so that is the difference. Edna has told me that she has angina. So I'm going to treat it as angina. Edna is sitting comfortably, and if she's got a medication, she has to take it. Have you got your medication with you today, Edna?
It's here.
Oh, have you? All right, that's great. Have you taken any yet? No?
No.
Okay. So what I would like Edna to do is take her angina spray, and she's going to take 2 of them into her mouth. So if you can take your medication for me, Edna. Yeah, that's good. And we want to wait for 5 minutes. Most of the time, these 2 sprays of medication is treated and Edna would normally be able to carry on with her day. If, however, Edna is still having pains after 5 minutes, Edna is able to take the medication again. If Edna is still feeling pain, Edna is allowed to take even more. However, if the person is still suffering, still has pain, and it is not going away, it is essential that we now call 999 and get emergency services on the way. It might not be an angina attack now. The person could be having a heart attack. But as I said at the beginning, normally with some rest and the medication, they're going to be absolutely fine. When else are you going to call an ambulance? So we've just talked about it and said 15 minutes if the person's not feeling better. It's also absolutely essential you call 999 if the person does not have the medication with them. If they don't have the medication, it will not get better. So angina. If you have family members that have angina, ask them where do they keep their medication should they need it. Ideally, they should have it on them all the time. But sometimes, like me, I forget and they may have left it at home. So angina, easy to treat as a first aider, but be mindful of when you must call emergency services. I'm Sarah, owner and trainer of First Aid at Work Aberdeen and Aberdeenshire, making training fun, engaging, but most importantly, memorable.